Hey, I'm Kayla. I'm going to be your student nurse today, and we're going to do an assessment on you. I'm going to close the curtain for privacy and perform hand hygiene. Can you tell me your name and date of birth?
Patrick Hansen, 7/25/92.
Great, and that matches his wristband. And Patrick, before we get started, would you like to use the bathroom?
Yeah, that sounds good.
Great. I'm going to help Patrick to the restroom. I'm going to assess his gait and his posture, and it looks great. And I'm going to assist him getting back up. I'm going to move the table to an appropriate height, and I'm going to make sure that there's adequate lighting in the room. Patrick, can you tell me what time it is, or what time it is, and where you are?
It's around 8 a.m. on Wednesday morning, and I am in the hospital.
Great, and by doing this, I'm assessing Patrick's level of consciousness, his speech, and his behavior. And then we're going to get started on his assessment. I'm going to start by feeling Patrick's head. Patrick, are you in any pain in your face or your head?
Nope, no pain today.
No? Okay. And I'm feeling his head for any abnormalities, any lumps, any bumps, the texture of his hair. He just got out of the gym, but other than that, it's pretty good. And his color, and he has nothing like lice. And then we're going to check Patrick's eyes. Patrick has no drainage. He has no redness, no swelling. We're just going to palpate around the area to make sure that it's how it should feel, and it feels great. Those glares of Patrick's eyes are nice and white. And I'm going to shield his eyes. And Patrick, I'm going to shine a light into your eyes. And both of his pupils are reactive. And then I'm going to have you follow my finger. All right, and I'm going to follow it some more, and keep your head straight, but move your eyes. Great. He did great. And then I'm going to check his nose. I'm going to check for any kind of abnormalities inside of the nose. I'm going to feel the ears and check and see if there's any temperature, any bumps, or anything that would be abnormal. And I'm going to check for some drainage in his ears, and they look great. Can you open your mouth? I'm going to check for any polyps inside of his mouth. Look, oh, raise your tongue. Great. And see if there are any abnormalities. Check for any abnormalities of the teeth. And then I'm going to start moving down. Patrick, are you having any pain in your chest or arms?
Nope, no chest pain.
Okay. And I'm going to start palpating his neck. And I'm going to feel his carotid pulse, one on one side and on the other side. And they are both even and +2. I'm going to feel his tonsure to see if he has any kind of swelling or edema. And I'm going to start by feeling his arms to see if there are any abnormalities in his arms, any lumps or any kind of swelling or anything. I'm going to feel both of his brachial pulses. They're even +2. I'm going to just watch. Feel his radial pulses. And they are also even +2. Can you squeeze my fingers? He has equal strength on both sides. His capillary refill is good. And I'm going to palpate his chest a little bit, see if it has any swelling or any lumps or abnormalities, and there is none. And then I'm going to put this down. I am going to listen to his lung sounds in the front. If you could take a deep breath in and out for me. In and out. In and out. Again. 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 Great. And then I'm going to start listening to his heart sounds. I am going to start on the right side and listen at that second intercostal space and listen to his aortic valve. Sounds good. I'm going to move over to the second intercostal space on the left and listen to the pulmonary valve. Sounds good. I'm going to go down to the fourth intercostal space and listen to that tricuspid valve. And then I'm going to move down to the fifth intercostal space. 5. And we're going to listen to that mitral valve, and I'm going to listen to that for 1 minute. All right, and he had 78 beats per minute, and when I checked his vital signs at the beginning, it was the same. And then we're gonna go around to the back. Patrick, are you having any pain in your backside?
Nope, nothing in my shoulders
Nope.
or anything.
And I'm gonna palpate his back, make sure he has nothing going on, and I'm gonna listen to his lung sounds. Can you take a deep breath in and out for me? In and out. Again. 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 One more time. All right, great. I'm going to assist Patrick into a supine position. Patrick, are you having any pain in your abdomen?
No, no pain in my
If
abdomen.
he stated that he was having any pain, I would start with the area that did not have pain first and work my way to the area that did have pain. But I'm going to start by listening to his bowel sounds and make sure those are normal. I'm going to start down here in the right lower quadrant, and I hear bowel sounds. The right upper quadrant, I hear bowel sounds. The left upper quadrant, I hear bowel sounds. And the left lower quadrant, I hear bowel sounds immediately. And then I'm going to start by palpating his abdomen, feeling for any tenderness, any lumps or bumps. And I'm going to move down to Patrick's lower extremities. I'm going to do the same on the lower extremities, kind of feeling for any kind of edema. If I felt them, then I would press to see the severity. And I'm checking for any redness, any swelling, any kind of lumps or bumps, and any kind of temperature changes. So I'm going to first feel his femoral pulse, and it feels even on both sides. I'm going to feel his popliteal pulse, and it is even on both sides. I'm going to feel his posterior tibialis pulse, and then his dorsipedis pulse. And both of those are even, ×2 on both sides. Patrick, can you push against my hands? And the other way, I'm just checking the flexion in his feet. I'm going to check his capillary refill. And everything looks good. I'm going to assist him into a sitting position, and then I would perform hand hygiene and exit the room.